I'm Dr. Bryan Burke, a general pediatrician with Arkansas Children's Hospital. Today we're going to talk about another one of my favorite topics, sore throats, and especially the importance of knowing the difference between a sore throat that's due to a virus and a sore throat that's due to strep. A sore throat that is due to virus will be accompanied by viral type symptoms: runny noses, vomiting, diarrhea, runny eyes, perhaps a little low-grade fever, perhaps quite high, and hoarseness. A strep throat won't have the viral symptoms that we just talked about. Rather, the child will have a sore throat, and it will be a very severe sore throat usually, accompanied by a high fever, but they won't have a runny nose, they won't have diarrhea, they won't have a runny eyes, cough, or hoarseness. It is very important to know that those viral symptoms mean that you do not have a strep throat. The reason that is important is 10% of people will have a positive throat culture even when they're healthy. You don't want to swab the throat of someone with viral symptoms because you will falsely diagnose them as having a strep throat. Indeed, if you have hoarseness or those other viral symptoms, you don't need to come to see the doctor because you simply have a virus. Chronic strep throat does not exist, at least not in the sense that you're going to get a strep throat and keep it for weeks without getting well. Recurrent strep throat does exist. You'll get a strep throat, you'll get well from it, and then you'll get it again. In fact, one of the reasons to have your tonsils removed is if you're having strep throats too frequently, but these must be very frequent. 6 in a year's time, 4 a year for 2 consecutive years, or 3 a year for 3 consecutive years. But these must be documented strep throats. You have the typical symptoms, you swab the throat, and you get a strep result back. You don't want to have your child's tonsils removed because you diagnosed strep throat yourself, or you had your physician phone in an antibiotic without seeing your child. That's not a good basis for surgery. Tonsillectomies decrease the number of strep throats you're going to have if you have strep throat as frequently as we described, 6 in a year's time, and so on. If you don't have strep throat that commonly, tonsillectomy doesn't help you at all. You can learn about other ways to keep your child happy and healthy by reading Parenting in Arkansas magazine. Free copies are available in daycares and schools.